Welcome. I'm Dr. Omar Bey, and this is A Moment in Medicine. Our mission is health, education, and wellness. Our goal is to grow old healthy. Grow old healthy. I've been a doctor for many years, and in my practice, what we try to do in my practice is we try to make the patient comfortable when they come to my practice. We make them comfortable because we want to strip away all the barriers and the anxiety and the fears of coming in talking to a doctor. That way we can have true communication and we can find a way to navigate that maze of medicine so that we can truly help those patients. With this show, I'm looking forward to doing the same thing for the audience out there. You know, each show we're going to bring on a guest, and we're going to have a particular topic that we're going to cover. Today's topic is nephrology, and I'm so pleased to have Dr. Nando Palekar from Newark Beth Israel Medical Center. Dr. Palekar is chief of nephrology at Newark Beth Israel, and he's also chief of the renal transplant there and the pancreatic transplant. Dr. Palekar, welcome to my show.
Omar, thank you.
All right.
Thank you for having me.
Dr. Palekar, is it okay if I call you Nando?
Please.
All right, thank you. You know, in talking about nephrology, the first thing I'd like to say is, I'd like you to explain what is nephrology, because it's such a huge term.
Nephrology is essentially a study of kidneys. The term nephron comes from that little diagram out there. Did you see this thing here?
Yes.
This is the nephron. This is a small filter and a particle in your kidney, and you have millions of this in each kidney. And they process the urine, they process the blood, they make urine, they process the urine, and the final product that you see has been processed by this nephron.
Oh,
so
right.
The field of study of the nephron is nephrology.
Right. Now, tell me, how many kidneys do we have?
We have two kidneys. Most of us will have two kidneys.
All right. You mean there's a possibility that people can be born with one kidney?
Yes, there is. And it's called renal agenesis, where there's only one kidney. The person is born only with one kidney, and the second kidney fails to develop.
Okay. Now, are these people normal in a sense that they don't need assistance as far as their renal functions are concerned? Can they live normally?
They can live normally. All you need is one kidney, Omar.
Oh.
All you need is one healthy kidney. And that is why, if you look at it, the kidney transplantation that happens, where there's this living donor kidney transplantation, where a healthy individual with two good kidneys can donate a kidney and then go on and be secure enough to know that they will have a completely normal life thereafter.
Oh, all righty. Okay.
So it's very possible.
All right.
Yeah.
Now, explain, because I know the word nephrology and kidneys, it's a big subject. And I know today we don't have time to cover the whole subject, but I just want to know, what do kidneys do? What do they do for us?
You know something? Kidneys do so many things, and there are some of the things that kidneys do that we don't even yet know. So every day there's a new thing that you find that the kidneys are doing. But particularly, the kidneys get rid of the poisons in the body.
Oh.
So when you eat and when you drink, and all the food gets metabolized, and then particles of that food are then excreted by the kidney. They also get rid of all the water in the body. So I mean, if the kidneys were not there, and if you kept drinking, you'd just bloat up. So essentially, the kidneys keep you in water balance. The amount of water that you drink is approximately the amount of water that you will pass out in urine.
Interesting.
So the kidneys will take care of the water excess, the kidneys will take care of the poisons, the kidneys make hormones, particularly a hormone called erythropoietin, which is really important in preventing you from being anemic. So it builds up your red blood cells.
Oh.
And that's a big function of the kidney. And there are numerous other hormones that the kidneys make that allow you to go on living in a healthy fashion.
Right. So you're telling me that if the kidney wasn't there, then I would walk around looking like the Michelin Man.
Absolutely.
All right. Well, you know one thing, what diseases out there? I know there are many diseases, and me being a pulmonologist, of course, I'm listing them out as far as the pulmonologist is concerned.
Right.
But what diseases out there really affect the kidney?
There are two big ones, and there are many smaller ones. But the biggest problem, and it's an epidemic in the country, it's diabetes.
Oh.
Diabetes, about 40% of all patients who are on dialysis right now are on dialysis because of diabetes having damaged their kidney.
Oh.
And then another 20% of them will be on dialysis because hypertension or high blood pressure damaged their kidney.
Right.
And then you have other diseases like lupus, then polycystic kidneys, kidney stones, infections. And for all you know, there are people who take a lot of Advil, Motrin, ibuprofen, and those kind of drugs.
Right.
They damage your kidney also. So people can end up on dialysis if they take a lot of those things on a consistent basis.
You mean I can go to the drugstore, buy something that's over the counter,
Yeah.
thinking I'm taking care of maybe some muscular pain,
Right.
and overtake it
Yeah.
and damage my kidneys?
And it can hurt your kidneys. Yes.
Wow. Wow. All righty. So we should know those type of things. Another thing that I'd like to is a kidney problem is it in families?
Right.
Do you see it in families sometimes?
There are kidney problems that are hereditary. Right? Polycystic kidney disease is a hereditary
No, hold. You just flew over my head now. I know. Polycystic. What does that mean?
Poly means many.
Right.
Cystic means actual holes. So there are many holes or spears in the kidney which are filled with this clear liquid.
Right.
And as time goes by, the spears and the globes, they become bigger and bigger and bigger. So if you have, say, 50, 60 small cysts in your kidneys and all of them grow, then they squeeze the good kidney tissue and cause kidney failure.
Oh.
So that's polycystic kidney disease. It comes in a couple of forms, but the prominent one is autosomal dominant polycystic kidney disease.
Right.
And that is inherited in families.
Right.
Lupus can hurt the kidney, but lupus is not inherited.
All right.
There may be a clustering of lupus in families.
Okay.
But
Now, just step back. You're mentioning words, and I know that I must explain this. Lupus is
the
go ahead.
larger name for lupus is systemic lupus. Essentially, is an illness where your body essentially attacks yourself.
Right. Okay.
So it attacks your joints. It can attack your heart. It can attack your blood cells, and it can attack your
kidneys. Alrighty.
And it can cause damage to the kidney that way.
Mm-hmm.
That's not inherited.
Right.
That's clustered in some families, but not inherited.
Not inherited. Already. Now, is there a particular gender, male, female, that may have kidney disease as opposed to the other?
Actually, kidney disease affects both males and females.
Okay.
Lupus will affect more women than men. When it affects men, it is actually far more serious. But if you look at ethnicity, kidney disease is far more prevalent in the African American community.
Oh.
And people have been trying to figure out all the reasons for that. And what you find is that there's a higher prevalence of diabetes. There's a higher prevalence of hypertension. And lately they have figured out that there is this mutation, or there is this gene that has changed a little bit in the African American community that increases their propensity for kidney failure.
Oh, all right.
And this is something that was discovered about 3 or 4 years ago. And African Americans with that particular mutation of that particular gene have a 10 to 15 times higher incidence of kidney disease.
Interesting. Now, is that you said that's associated? Usually, it's associated with either high blood pressure or diabetes as well.
Correct. They will have high blood pressure much more commonly. Yeah.
What about age? Do you find that young kids or young children have kidney disease, or is it more in the adult population?
No, young kids can have kidney disease also. As you age, though, your kidney function declines, but that's a normal decline in kidney function.
Okay.
So if you then on top of that have high blood pressure, diabetes, illnesses of other kind, then that can accelerate the damage to the kidneys and cause kidney failure.
Right.
Now in terms of young people, there are diseases called glomerulonephritis, where the filtering units of the kidney get affected, particularly in the young. And they can then progress on, if not properly treated, to kidney failure.
Oh, all right then. Yeah. Now, you're talking about there are elements, well, I want to talk about this. There are elements, and the kidney is such a wonderful organ. I appreciate it. There are certain elements in the body that the kidney, I think, they regulate. It's sort of like potassium and sodium, and these are also important to each little cell in our body. Tell us about this, because the kidney, without the kidney, we're in trouble.
Look, all of us came from the sea. Mm-hmm. So all of us have some salt in our blood. Right. But you can have only so much salt. Right. You cannot have really a lot of salt, otherwise you get dehydrated, you'll be thirsty, and essentially you'll cause morbidity, and your brain sort of will start shrinking.
Okay, so, I'm gonna hold your thought. And you throw out another term that I'd like to morbidity. As far as morbidity means?
Morbidity is where you start getting illnesses, different kinds of illnesses that cause ill health.
Okay.
So different types of ill health that will be caused by a particular thing essentially means the morbidity of that particular thing.
Right.
So salt is important, and the kidney's role is to maintain that salt concentration in your blood.
Right. So
you cannot have really a higher salt concentration or a lower salt. It has to be maintained in a really rigid range, 135 to 145.
Right.
Okay, there's a thing called milliequivalents per liter. That's the scale for it. But it's 135 to 145. Now, if you go out, eat a slice of pizza, all right,
right,
and your sodium goes up to 147, I'll tell you something, you will be looking for water everywhere, because it makes you so thirsty that you want to get your salt back down below 145. So you will drink as much water as is necessary to do that.
Right.
The body will do that for you.
Right.
And the same thing with potassium. Potassium is a substance that is present mostly within the cells of the body. So an excessive amount of that outside the cells, like in your bloodstream, can cause your heart to stop and things like that.
Right.
So the kidneys will maintain that too. But if the kidney function declines, then that becomes a problem in doing that. And then you have to then watch your salt, watch your potassium, see what you eat. There are high potassium items like tomatoes, strawberries, oranges that we tell people not to consume if your kidneys are not working well. Right.
Now, what about, for instance, you have a child or somebody who's out doing sports, you're playing basketball and you're sweating and you're sweating and you're sweating. Now, the kidneys play a part in retaining fluid too, so that you don't dehydrate, doesn't it?
Absolutely. Look, the more you sweat, the less urine your kidneys will make.
Right.
Okay, because the role of the kidneys is to maintain water balance also.
Okay.
Not just salt balance, not just potassium balance, but water balance. So it's the minute you start sweating a lot, the kidneys will clamp down and stop your urine.
Oh.
So you'll make a really concentrated small amount of urine. Okay. Right. And then they'll make you thirsty. You will feel like you've got to drink water and get that balance back again.
Right. Now, I know that being a physician, of course, we always read something somewhere. Somewhere I read that the kidney, it filters over, I think it's a 24-hour period, 200 quarts?
Correct.
Wow.
I can tell you that 1/4 of the blood supply, 1/4 of the heart's volume, when a heart pumps, 1/4 of that is taken up by the kidney.
At one time? Woo.
And 75% of it is given to the rest of the body. So just imagine how much blood is flowing through
at one time
every day.
Now the blood flows through, it pulls out the water, then it pushes the water back, and it only allows so much to go into the urine. How does that happen? Explain that to me.
That you can see it here. Can I?
Yes, please.
Look at this. Okay, this is the thing that we talked about. It's called the nephron or the glomerulus. It's got two names.
Right.
So the blood comes in, goes through this thing, and it's divided into small capillaries. Okay, so the blood will come through here, go into the capillary. It'll get filtered out in here. Okay. Now this is something known as pre-urine. It's not actual urine. It's pre-urine.
Right.
When this urine then goes through this entire tubule, it gets processed, and the water is pulled back, salt is pulled back, sometimes bicarbonate is pulled back to maintain the acid level in the blood, and the final urine that comes out is comes out of here. So even if you have 120 liters of urine that is processed in a day,
Right.
your final urine output could be as low as 1 to 2 liters.
Wow. Wow.
And that's what the kidneys do.
Right, right.
And it's-
Now, I know you and I both work at different ends of this, but as far as acid-base concerned,
Right.
I'm a pulmonologist, so of course, I think of it as breathing off CO2, and you think of it as the kidney.
Correct.
Tell me, I know that our bodies, it's like a chemistry set.
Correct.
And we have a certain pH, and I know everybody out there can think back to high school and when they thought about doing a chemistry lab in pH. Tell us about how the kidney handles the pH and what it means as far as acids and bases. Just briefly.
See, every time you eat, when you digest, you make acid. The more meat you eat, the more acid you make. Now, if you allow all that acid to accumulate in your blood, then you will have hydrochloric acid sitting in there, really bad. It'll corrode everything.
Right.
So the kidneys will get rid of that.
All right.
And they will keep the acid balance on a 24-hour level.
Right, right. Okay. Yeah. And in ending our conversation, I would like just a very short, just as for the young out there, what brought you into medicine? What made you decide? What made that your passion?
You know, ever since I was 4 years old, I wanted to be a doctor. And in my country, when I did this, we have to take an entrance exam. So I took the entrance exam, and I missed the class by 1 mark. So I ended up in architecture, which I hated, and I applied back again, and I got into it next time around.
Right.
And that's how I got into medicine. And as far as nephrology goes and the study of kidneys, look at what they do.
Right.
I mean, it is so fascinating. It's almost like a mystery. And it's very intellectually challenging, and it allows you to become a good doctor, understand everything in so many different types of systems by just doing nephrology.
Right.
So that's what
That's
attracted me to it.
Well, you know, Dr. Palagar, I thank you very much for coming in and talking about the kidney. We've learned so much today. Thank you very much.
Thank you, Omar.
All righty. All righty. This has been a great time with Dr. Palagar, but now it's time for just us to talk. Just talk just a little bit, because there are certain things that we need to know as far as the show is concerned. The show, you allow us to bring this show into your homes, but yet and still, we need a way to communicate to you. We need a way that you can come back to us and let us know what you think about the show, what you think, what your ideas on medicine are rather, and basically I want to hear from you. So we've developed a website, www.medmoments.com. That's www.medmoments.com. And go to the website, email us, and let us know exactly what you think about the show and what you think as far as medicine is concerned, so we can communicate and do a better job. As far as I want to just say one thing, and give you just a little example of and why we call it Med Moments. It's because there are times when each and every one of us had those moments when we say, I should see a doctor. And that's a med moment. For instance, there's a guy that comes to my office and he comes and states, every day I go to my office and I run upstairs, and this time I got to the office and I had my cup of coffee. I looked at the elevator and the elevator was taking so long, and I ran up the stairs and I got halfway up the stairs and I had that chest pain. That's a med moment. Those are med moments. We have them all the time. And that's why we called our website Med Moments. So I want you to come on and email us and let us know what's going on out there so we can come in and help you. As far as other things, sometimes it's just, there are times when you go to your doctor, and if you walk in and you have anxiety, I want you to be comfortable enough to strip away that anxiety and actually speak to him. And sometimes, and in the show, and as we go along, I'd like to just take a moment and just talk about different steps in medicine, or different ideas, or different things that we can do to make it more comfortable in talking to our physician. So, number one, ask questions. You know, when you walk into your doctor, if he's talking to you, if he says something that you don't understand, ask a question. It's okay to ask a question. It's really okay to say, hey doc, I just didn't understand that. Could you explain that just a little bit better for me? And also, before you go into the doctor, make a list. I know there are patients come to me all the time and they get there and they're sitting down talking and basically they say, you know, doc, I had a toothache. But as soon as I got in here and sat down, I can't remember what tooth was hurting. Make a list. It's so easy to make a list. If there are procedures that the doctor wants you to go for, you know what you do? You're asking him about that procedure. Asking to explain it. Basically, you know, how long is the procedure going to be? Where is the procedure going to be? Will you be sedated during the procedure? Will it hurt? You know, things like that. It's important that we understand that you can communicate with your physician. And, you know, another thing, and I always tell my patients, if you have to go to the hospital, you know, and if you sit down with your doctor, ask him which hospital that he is on staff at. Which hospital should you go to? Which emergency room should you go to? So that you make sure that he will be the one who's taking care of you. And for instance, if there's a surgery or something like that, have him describe the surgery. That's okay. You know, is it going to be a long surgery? Is it going to be, you know, as I stated before, will you be sedated? These are the things that you would want to say as far as that's concerned. But you know, it's so important that we pull together as a community, and that we talk to each other, that we, you know, take care of each other. And we can truly take care of each other with that unique thing out there called social media. Social media allows us to communicate. It's such a great medium at this particular point. And if we can use social media, using things like our Facebook, using things like Twitter and email, we can communicate, we can help each other, and we can come together and do a great, great job. All right. I'm looking forward to all the shows that will come up. And as far as some of the shows that are coming up, it's going to be interesting. But this time, what I want to do is I want to recap. I want to recap what we've done today. Basically, we've talked about our mission, our goal, as far as health, education, and wellness. We talked about, as far as our show is concerned, how we're going to come into your homes and we're going to use the social media to communicate. I appreciate Dr. Palakar coming in and talking about nephrology. And also, as far as med moments are concerned, what a med moment is and why our website is called medmoments.com. In ending, until next time, I trust each and every one of you continued good health. And there's one thing I definitely want to tell you. Before you change any therapy, before you do anything that anyone else has said to you as far as your medical care, I want you to consult your physician or your medical care person so that you make sure that it's right for you. Even things that I say on this show, do not institute them until you see your physician. As I stated again, I am so happy that we're here, that we can bring this medical show to you. And until next time, I'm going to say peace. And everyone out there, continued good health.